Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about cracked tooth syndrome. Cracked tooth syndrome is tooth problem present once a tooth has an extremely small fracture in it. Many teeth contain cracks which can be too little to appear on X-rays. Occasionally the cracks are under the periodontal. The individual with the cracked tooth syndrome may find that they have discomfort in close proximity of the fractured tooth while eating or biting down, however not be capable to determine precisely which tooth is leading to the discomfort. The tenderness or discomfort could be gentle or extreme. It could endure a short time or perhaps quite a long time. It could be unpleasant only if you consume particular foods or perhaps after you bite in a particular manner. You are not going to sense a constant pain, just like you could in case you have a cavity or perhaps abscess. The tooth could be extra tender to cold environment. The fractures or perhaps splits in the teeth are highly tiny, they could be not recognizable. These are not continually noticeable on an X-ray. In case the damage becomes bigger, a bit of the tooth may possibly break off. Additionally, you can get an infection. This could occur in the periodontal around the fractured tooth. Perhaps you may observe acne-like inflammation on the periodontal close to the tooth. Pus can drain from the acne, generally recognized as a fistula. Individuals who clench or perhaps grind their teeth have progressed periodontal condition. Massive fillings or perhaps teeth with root canals tend to be more at risk of encounter cracked tooth syndrome. Individuals who have had one or more encounter of cracked tooth syndrome usually tend to encounter substantially more fractures. Lower back wisdom teeth tend to be more vulnerable to fractures compared to some other teeth because they take up almost all the pressure from eating. Occasionally, the manner a person's teeth bind will be able to put an excessive amount force on just one tooth. This can potentially contribute to the tooth to break. Lots of people with cracked tooth syndrome experience discomforts for a long time. Cracked tooth syndrome is among the most challenging dental conditions to identify due to the fact the discomfort is not consistent. Superficial fractures that impact just the tooth's enamel and therefore almost never lead to cracked tooth syndrome. Basically, gentle polishing of the tooth to erase any kind of abrasive areas might be required primarily for visual purposes. Small cracks impact just the external layers of the tooth. An amalgam or perhaps composite filling up might be required to fix the destruction, in case the deterioration cannot be recovered simply by smoothing the tooth exterior. Dental porcelain veneers could also offer outstanding visual outcome. Cusp fractures have an effect on just the specific eating surface areas, the cusps of the tooth enamel, but not the pulp of the tooth. Small cusp fractures are restored by filing the surface areas of the tooth to bring back the structure of the tooth. In case the crack is substantial, an only or perhaps dental crown is necessary. Cracked teeth is a severe fractures that impact the pulp of the tooth. Endodontic therapy, root canal is required, and then dental crown repair. In the event that the crack stretches below the periodontal line, periodontal surgical treatment might be required to reveal the crack in order that a dental crown could be positioned. The tooth is separate vertically into a couple of individual elements. The bigger of the two elements of a multiple-rooted separate tooth could be rescued after root canal therapy and dental crown repair. The other part of the tooth needs to be extracted. On the other hand, on many occasions the tooth needs to be taken out. Divided root are top to bottom cracks of the root of the tooth. In situations of single-rooted tooth, the tooth needs to be extracted. In multi-rooted tooth, the dental professional are going to attempt to preserve the tooth by extracting just the impacted tooth root with endodontic surgical treatment. Cracked tooth syndrome is determined by dental evaluation. The dental professional in most cases conduct a bite exam by telling the affected person to bite down on a particular tooth instrument that is put on the tooth with the presumed fracture. The dental surgeon holds the device against tooth cusp each time as the affected person bites down. When the tension of biting down creates discomfort, the fractured part of the tooth is found. Other techniques which are occasionally chosen for finding a fracture are coating a unique dye on the tooth, visual examination and also X-ray. It's possible you have X-rays done. However, X-rays oftentimes do not reveal the fracture. Your dental surgeon are going to look at your oral cavity and teeth, concentrating on the tooth with problem. Dentist could use a spiked tool known as an explorer to look for splits in the tooth. Your dental surgeon also looks at the peduncle close to the tooth. Early detection of a fractured tooth can be extremely essential for the outlook of the tooth. In case identified soon enough, with the appropriate therapy, the tooth could be saved for years regardless of the damage. In case the crack is ignored, problems such as tooth bacterial infection, abscess or perhaps cracking of the tooth may result in losing the tooth. Restore of any tooth, presumed to be damaged, is usually high risk, without any warranties can be made, concerning the end result. Remedy for cracked tooth syndrome is determined by the place, form and scale of the fracture. Frequently, tooth root canal is carried out, after which the tooth is protected with a tooth crown. Some situations, for example in case the tooth is cracked beyond restore, demand extraction of the affected tooth. In a tooth that has multiple fractures, posts are put inside the tooth to strengthen it. Around 20% of teeth that has cracked tooth syndrome will require root canals. After a tooth root canal, the tooth are no longer able to be vulnerable to temperature range, however it still are going to react to tension. In case you experience discomfort before the tooth root canal, you might continue to experience certain discomfort later. It is not going to be as intensive or as consistent, however it can still manifest. Sometimes, the tooth may have to be extracted. Certain fractures impact the root of the tooth in the jaw. There's no possibility to repair this kind of crack. In case your tooth is extracted, you could have it restored with a dental implant or a dental bridge. Your dental professional could make a night safeguard, a molded bite element to stop you from grinding the teeth. This certainly will reduce the discomfort from grinding. For certain patients it could end tooth tenderness. The night protects are typically used while sleeping. This also could be used at other occasions in case clenching or perhaps grinding occurs throughout waking time. Regardless of the proper remedy, around 10% of cracked teeth have nervous system that continue on to perish. The tooth could move moderately within the bones, so this minor motion can flex the fracture from underneath regardless of the dental crown over the top. Occasionally the present bacterial deterioration is so significant that the nerve continues to perish no matter what we undertake. Early on therapy is for this reason advised to decrease the scale of the crack and the degree of bacterial invasion. For that reason, in case you have a cracked tooth syndrome, be it in a tooth with an active nerve or perhaps a lifeless one, you require the protecting wraparound benefit of a tooth crown. Nevertheless, I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedy Land. Take care.